Hello, my name is Allyse Zondlak, and I'm a fourth-year medical student at the University of Michigan Medical School. Thank you for the opportunity to present our work on creating a disability health curriculum. I want to start by asking you to think about how comfortable you'd feel answering the following questions. What is a disability? What health problems are people with a disability at increased risk of developing? And what special considerations for labs, imaging, or procedures should you take into account for individuals with disabilities? If your medical education was anything like mine, odds are you aren't too sure how to answer these questions. But now replace disability with pregnancy. Without even hesitating, you could probably tell me how to confirm a pregnancy, that they're at increased risk of blood clots, and that I should think twice before getting a CT scan. I also could have asked you to plug in children or elderly, and again, if your medical education was like mine, you're probably decently prepared to answer these questions. In the US, 1 out of every 4 adults has some form of disability, and individuals with disabilities face several health and healthcare disparities. Although sections of the medical school curriculum often focus on caring for special populations, attention is rarely placed on preparing students to effectively care for individuals with disabilities. Therefore, we developed a 2-week elective for clinical medical students in order to address these education gaps. The disability health elective includes 3 general components: didactic, clinical, and community experiences. The course covers various disabilities, including physical, sensory, and neurocognitive disabilities. However, in order to provide content that is personally relevant and readily applicable, experiences can be tailored to the individual career goals of each student. The majority of our didactic experiences are provided online through MILend. However, we also include lectures from our faculty and community partners. Our clinical preceptors include over 27 faculty members across 13 different disciplines. These rotations give students hands-on experience evaluating and managing health-related problems for individuals with disabilities. And lastly, the elective incorporates community experiences to allow students to interact with individuals with disabilities outside of the healthcare setting and get a better understanding of how the challenges they may face in their everyday lives impacts their health. The elective was launched in September of 2020, and a total of 6 students have completed the course to date. Overall, we've received positive feedback about the elective. Working directly with members of the community has been referenced as being particularly impactful for students. And one student noted that the course overall was an invaluable educational experience. Adequately training healthcare providers in disability health is essential to improving care for a significant proportion of the population that remains underserved. A 2-week clinical disability health elective is an effective way to provide medical students with training on caring for individuals with disabilities. Our future efforts will focus on expanding the scope and reach of the course in order to move towards improving care for patients with disabilities. Thank you, and feel free to reach out to me with any questions.